Welcome to Tribe Talk, everyone. You're here with Laura Neal
and Rachel Evans.
And today we're talking about what progress really looks like in trauma-informed care.
So if you're looking at your child's behaviour and thinking that nothing's improving, then you're not alone. And in today's episode, we're going to be unpacking what real progress looks like in trauma recovery and how it's not that dramatic and how important it is to focus on those small wins. So when we think about trauma recovery, we have to think about the child's experience, so their trauma experience, their trauma history, and how that has impacted them, because that directly impacts then what trauma recovery looks like for them.
Yeah.
So their trauma history might be filled with their experiences such as neglect. Maybe they've experienced domestic violence, an adult that's not emotionally available to them. And these are just examples, but how that has impacted a child will influence their journey to trauma recovery. So that influences what support needs to be put in place, the behaviours that they're presenting with, the therapies that need to be considered, and what their treatment plan essentially looks like. And then that's when we are stepping into the realms of what does trauma recovery look like and how long does that take? Because I think that is the question on parent and carers' minds.
Yeah, how long is it going to take to start to see improvements?
Yeah, it's like when am I going to see my child being able to regulate their emotions more effectively? When am I going to not see some of these behavioural outbursts? Because they are the times or the incidents that makes parenting really tricky. So we know that trauma recovery isn't linear. So we have ups and downs, and children that make a little bit of progress, and then sometimes we don't see progress for a long time. We see spikes in behaviour. So what we mean by progress is development of skills, reductions in challenging behaviour, and sometimes we see these spikes in behaviour where we might feel like there's a lot of calm in the home, things are going really well, and then behaviours just come out of the blue. And it's all depending on what's going on in that child's life that influences what trauma recovery is gonna look like. So what support they're accessing, therapies that they're accessing, what does contact look like, what are those triggers in their immediate environment, how is their environment set up. There's lots of things that influence trauma recovery, and I think for this podcast we want to be highlighting that trauma recovery is so individual to every child that we support, and then that will directly impact on how long children take to go on that trauma recovery journey. How long that's going to take, when we're going to see some progress.
And I think coming back to progress and what you said, progress means different things to different people. Your end goal might be where you want to get to eventually, but actually progress might be many steps before that as well.
Yeah, and I was even thinking about the different expectations as well as parents and carers when you're just going into maybe a parenting role or a foster caring role, and when they're going to see reductions in challenging behaviour. So that's what crops up a lot, isn't it? It's that challenging behaviour is happening frequently and it's difficult to manage. So when are we going to see reductions in challenging behaviour? Or from an adoptive parent point of view, where they go into parenting but presuming that there's not going to be any challenges, but we see challenges from the child that they're parenting. So looking at it from two sides of the coin, really, that there's not going to be any challenges for that child, and we see challenges, and when are we going to see some progress, or there's already a lot of challenges, high level challenges, and when are we going to get a break?
So
like you said, Laura, you had, like, in terms of progress, if we define progress, we have that end goal that we want to get to, but there's loads of steps prior to that we need to get to.
Yeah, and I think people focus on that end goal so much. So when are they going to not need any support in school? When are they not going? When are they going to stop hitting anything? When are they going to stop tantruming? When are they going to stop having emotional outbursts?
Yeah.
But actually, trauma recovery is so unique and it can be lengthy. So you have to break it down and look at the steps in between that as well.
Yeah. And it's important to focus on those steps. So when we are working with a child that's displaying high levels of challenging behaviour, having a goal such as reducing those moments to 0 is a long time away. There's lots of steps that we need to overcome before we reach that goal. So it might be that we're reducing the frequency of those challenging behaviours that are happening throughout the day, or the duration in which they're occurring for reduces, and focusing on those small wins.
Yeah.
Because it's just really important to focus on those small wins.
Yeah. Or also in relation to that, so if you're thinking of developing rather than reducing a difficulty, developing something the child needs, what if they can accept a little bit more comfort? So they wouldn't tolerate you tucking them into bed previously and now they do tolerate that. Or they would never even attempt to brush their teeth and now they're picking up their brush and they're putting some water on it. You've got to do the rest, but actually you're getting that little bit closer. And for many of our children, I think that's where their trauma recovery journey starts, really, is with those little wins.
Yeah. And like you said, the development of skills, because there's so many different skills that we might be developing in different children. Like you said, it might be those day-to-day tasks such as brushing teeth, getting dressed. It might be an unrealistic goal for a child to follow all of those steps within a morning routine, but breaking them down into the smaller steps. And if we are able to teach them to put their t-shirt on their trousers independently without us asking a million times, that is progress. It's looking at the skills that we need to develop, and also some of those maybe those challenging moments that we're also reducing, but also the relationships between child and adult, so like foster carer or parent, and supporting that development as well. So the trust, that would be like a big goal. But those if we broke trust down into what that looked like, into smaller steps, we should be focusing on those types of wins.
Yeah. I think that's something that comes up a lot in attachment. So we want this child to have a more secure attachment. Often you're going to have lots of those little wins to be able to get to that more secure attachment. So it might be they can accept more comfort. It might be that they come to you with a tiny little problem but don't tell you their bigger concerns or worries. But you are starting to see movements forward. Because actually a more secure attachment can take years to form, whereas those little wins you can start to develop now and build on, and they'll be the ones that eventually result in that more secure attachment.
And linked to that, a child that might be really wanting that contact with their primary caregiver, but then also rejecting of that. So we've worked with families in the past where just accepting comfort is our bigger goal. But a smaller win towards that was them just sitting on their lap, like to their back to their parent. That was a small win, because they were showing that I am getting more comfortable and accepting that, but I can't give you eye contact right now. So progress is really defined in terms of, are we seeing reductions in challenges, and are we seeing children's development of skills, and included in that is them being able to understand their emotions, being able to regulate their emotions, accepting comfort, building those trust and connections with parents and carers as well. So lots of that, lots of those examples come into caring for a child that's experienced trauma. and we're not gonna achieve those bigger goals. We're on more of a journey to get into that.
Yeah, and I think it's worth acknowledging that this journey takes a lot of parent and carer effort as well. So often it is steps you're building up over time, and it's those little wins, those little steps forward that are navigated by parents and carers. So you will be the ones pushing this forward, can be providing that consistency each day. It might be teaching a skill, it might be helping to de-escalate, and over time they all build up on each other. But it is quite carer intensive.
Yeah. A lot of thought, planning, but also like your parenting strategies as well, because they are not typical to, in terms of like your typical parenting strategy. It's often providing a lot more.
And when we're talking about these difficulties, I think, because obviously we're a therapeutic organisation, and I think fairly often we're asked to provide a therapy to reduce a challenge or improve a skill. We can do so much within a therapy session, but that is never going to change if things are not happening at home as well. So it is really working together.
So we've just gone through a couple of different examples of goals that we might be working on with children and families in terms of taking steps to trauma recovery, and what progress really looks like, and celebrating some of those small wins, because that's what it's all about, is having that bigger goal, and then having those steps in terms of how we get to that goal. But should we just take a look at an example and walk through then what a bigger goal would be for that child, and then how we would break that down. So in our case example, we have Liam. He's 11 years old, so he's currently in foster care, and he's been with his foster carers for 6 months, and his trauma history have included many things. One of those things is living in a chaotic household. And what his carers are reporting is that mornings are particularly difficult. So he's asked to get ready or follow that morning routine, and he refuses. Says no, doesn't want to engage in that routine. So he's not getting dressed, he's not brushing his teeth, and then not coming downstairs to have his breakfast and continue with that morning routine. This then leads to escalations in behaviour. So carers are reporting that these outbursts, they're difficult to manage because they're just so intense. There's lots of physical aggression, there's verbal aggression, and this can last up to 40 minutes. You can imagine trying to get out of the house to go to school, you're set back and Liam's late. And carers are really stuck in terms of how they support Liam now, and they're saying that nothing is really improving, rather than the problem is getting worse. So what they want to be focusing on is making sure that their morning routine is more predictable, and there's a lot less conflict, and these transitions out the door are a lot quicker. This is a carer's goal.
So as you were talking then, about 5 little boys sprung to mind where I've had very similar conversations with foster carers and adoptive parents. So this is definitely, I think, an issue that many of our parents and carers are facing, because I can actually sit here and think of at least 5 little boys who...
So you have difficulties like this in the morning. Just think how much pressure, isn't it, that's put on to parents and carers. You have to get out to the door on time to get your children to school on time. Otherwise they're going to have a late mark, or they might have detention and things like that. So it just makes the problem a lot bigger.
And I think particularly for the ones I'm picturing in my mind, it's those relationships that get broken down as well. So if there is that physical aggression in the mornings, that refusal to do things, it ends up in that conflict where parent or carer is then telling the child off a lot of the time, and those relationships, instead of building those relationships up, they get broken down, and there's an almost divide that forms them between the adults and the child.
So just look at the knock-on effect, really, to not just school, but also relationships between parent and child as well.
Yeah.
But taking the carer's bigger goal in terms of like having a calmer morning, you know, quicker transitions and all of that, we really now need to break that down, isn't it? So with some support that was provided to Liam and his family around managing that difficult morning, breaking that bigger goal down. So with some focus around supporting that morning routine, so teaching some of those skills, having clear expectations, ensuring that there's lots of opportunities for reinforcement. What the family would then report in after some time of consultation support was Liam would then come downstairs, but there's no shouting. So some of that morning routine was followed with no verbal aggression that was attached to that. He was still refusing some parts of the morning routine, but he would engage in some of those steps in his morning routine that were easier for him to follow. So there was a lot less refusal, which then meant that those big escalations in behaviour, they reduced from 40 minutes down to 10 minutes. They were short-lived and a little bit more manageable. So it's given the family a little bit of a breather, essentially, as to, you know, we can kind of get through this day or this morning routine. And they also reported that Liam would then started to apologise for or like reflect on some of his behaviours and acknowledge that, you know, he made a step that he wasn't really proud of. So going back to what you were saying in terms of like repair, connection, relationship, was seeing some of that reflection going on for himself and understanding, I'm not following the house rules here. I'm engaging in some behaviours that I don't want to engage in, and acknowledging that with his carers. So we had this bigger goal of fixing morning routines, but we focused on those small wins, and I think if we don't point them out to foster carers, or foster carers don't notice them, it's quite difficult to stay in that positive mindset. So yeah, it's really important to think about your bigger goal and what you want to achieve, but some of those steps that you're taking to get there, and some of those small wins that you're seeing. Yeah,
because when you live in it, it can be really difficult to see those small steps forward. That comes back to the podcast we did a couple of weeks ago on data. It's one of the reasons why we collect data, so we can really highlight where we are seeing those improvements, because often those little wins will come way before you get to that end goal and that big win.
Yeah, and I was going to touch on data actually, because sometimes in our consultations it do help when parents and carers are saying, I'm not seeing any, or I'm not feeling like we're making a lot of progress. But it's when we present the data in front of them and say, yeah, we've gone from like a 40-minute incident to a 10-minute incident, or he's brushing his teeth now, he's coming downstairs. It's not until we're pointing that out, and sometimes that does have to be visually, it provides parents and carers that reassurance that they're on the right track, they're doing the right thing, they've got the right strategies in place, and it prevents us throwing out something really effective. Because we're going off a feeling that it's not going as well as what we'd hoped.
And it comes back to that progress, not perfection, because I think the reality of it is we're not going to get perfection, and particularly with children who've experienced quite significant trauma, there's lots of things that might be going on. So you might be working on these difficulties in the morning, but there's other difficulties throughout the day as well, and you're seeing this small improvement in the morning, but we haven't actually focused on the rest of the day yet, and that doesn't improve, because what we know is that children who've experienced trauma, they also struggle with generalising to other areas of the day or other settings as well. So you might see some improvements at home but not elsewhere. You might see some improvements at a certain time of day but not elsewhere, and it is a process, and it can take time.
But it's all those things kind of come together in terms of the support package, and being aware or knowing what you're working on so you can focus on those small wins. Like, this is a behaviour that I want to target and to improve or reduce, or I want to teach this skill, but knowing where you are in that process is really important. So you're getting a little bit of reinforcement out of I got the right strategy, I'm doing the right thing. So from the experience of working with parents and carers, that's what they want, is that reassurance that they're doing the right thing, and sometimes that's a little bit more powerful coming from another professional rather than a partner or a husband and a wife, where you're trying to work through those things together. It's a lot more powerful coming from somebody else who's saying, keep going, you're doing the right thing.
So why do small wins matter? Small wins are really important for a number of reasons. What's the first reason, Rachel?
So they motivate parents and carers, isn't it, and children. So when you're focusing more on those smaller wins, you're seeing those glimmers of progress or glimmers of hope. That then provides parents and carers with the sense of, I'm doing the right thing, I'm on the right lines, my child is making progress in the right direction. And for children then, they're having more opportunities to access reinforcement from their parents and carers. So the whole mood lifts, I find, when you're focusing more on those positives and those small wins.
And then secondly, that helps avoid burnout. So how many parents and carers come to us because they are in burnout? They can't see a way forward, they don't know what's next, what they can do, but if we can get some things in place, we can start seeing those small wins. It can really help avoid that burnout, because you can see you're going in the right direction, you can see you're making some progress, you feel like, actually, I'm getting somewhere, and you're far less likely to burn out if that's what you can see day to day, rather than nothing's working, there's no hope, there's no way forward.
And that really then builds momentum to more positive outcomes. So there's a famous quote in behaviour analysis, isn't it? Like, behaviour flows where behaviour goes where reinforcement flows. And that's just so true. The more that we're focusing on the positives and reinforcing more of those positive behaviours, we're going to see an increase in more positive behaviours. So we want to be focusing more on the positives.
And we're really shifting that narrative then from nothing's working to some things are working, we just need to find more of what's working and move things in that direction. So we're shifting not only adults' narratives but the child's narrative as well, which is really important, because if we're feeling burnt out as the adults, you can imagine how the child is feeling as well in that situation where they feel like nothing's going right, and that's not a situation they want to be in. So we need to shift that narrative for everybody.
The whole the mood of the house, or the feeling of the house just becomes a lot more positive when you're focusing more on those small wins. A question that we get asked often, which we're going to finish up on today, is, what do I do if I don't know where to start? I'm at a point where nothing's going right, I'm not making any progress whatsoever. Where do I start? Good question, and something that comes up a lot. And going back to what you were talking about with parents and carers at burnout, it is difficult to see light at the end of the tunnel, isn't it? When you're thinking, nothing's going right. But I think it's important to know what your end goal is, and then making a note also of those steps that you need to take in order to reach that goal. So we've just broke down Liam's example, haven't we, in terms of a morning routine is really chaotic and it's really difficult to even get through the morning routine. But what is it about that morning routine that you need to focus on? Does Liam have the skills to be able to brush his teeth himself, or is that something that we've got to focus on? Do we need to be supporting emotional regulation more within the home with some emotional labelling and providing some more coaching to him? So it's thinking about the behaviours and the skills that you want to target and breaking them down. Because I think that helps parents and carers see things a little bit more clearly and they know then what they need to prioritise first.
Yeah. And then I would say, in addition to that, is definitely starting with something easy, particularly if you feel at the point of burnout or that nothing's been going in the right direction for a long time. Start with something that seems easy and you know you can get a win from, because that can build that momentum that you were talking about then. Once you get that momentum, you start to see that everything else starts to fall into place, and you get more little wins, and all of a sudden you get a big win.
Absolutely. And I think I would add to that as well, Laura, because if parents and carers are listening today, one thing that they could take away is, if you're in that mindset of nothing's working, what am I going to do, and you're going to focus on that small win, just having the awareness, I suppose, in your responses. So and flipping it a little bit from I'm feeling like nothing's working to what positives can I focus on. And I think if you become more aware of your own responses, you start looking out for more positive or more appropriate behaviours, and once we start to notice them, acknowledge them with our children, I think that's when when we start the ball rolling then. So just having a bit more awareness of your responses and how you're noticing more those positive behaviours, really.
Yeah. So that's the end of our podcast today on progress doesn't have to mean perfection. Remember that trauma recovery doesn't often happen in a straight line. Often you'll have small wins, and over time they amount to big wins.
So thank you for joining us today. Remember, subscribe to Tribe Talk for more trauma-informed care in practice.